First, I'm going to talk about our care management service. Our care management service, as I said, is staffed by social service providers, mainly social workers. We provide interventions in what we call the 6 life areas. Those are just general categories where we typically provide support. There's a whole host of other topics that can come up that fall outside of those 6 life areas, and we are able to work through those with our clients as well. But the 6 life areas are a nice catch-all, and they include the following things: public benefits, housing, medical, which involves both physical and mental health, social connection, vocational pursuits, and finances. On the financial piece, the care managers are not going to be doing daily money management. But if a client is not able or not needing to utilize our financial services, then the care manager can refer people to resources around personal finance concerns. Care management can be provided alongside trust services or as an independent standalone service where we're hired directly by a family. When the trust is the payment source for care management, we are especially mindful of getting the best bang for your buck. Trust care management is usually intended to be very targeted and to get clients linked up to other things that are out there. Although sometimes people do want us to be heavily involved. And if there are trust funds to support that, we are happy to do that. But the trust team and the care management team collaborate to ensure that each side is working in the most effective way possible. Our direct hire care management starts with a goal plan. The goal plan outlines the goals of our services. The goal plan has a category for each of the 6 life areas. But many goal plans don't have a goal in each of those 6 life areas. That's completely okay. In fact, sometimes the goal might be as simple as establish rapport with your care manager so that the client is comfortable with reaching out to us as things come up. The goal plan outlines the scope of services that the care management is being hired for. From there, we can actively work on those goals, and we will be tracking all of our time and billing for that time. Our time is billable at an hourly rate. If we're doing something that takes less than an hour, then we're just billing for that fraction of the time. Our invoices are issued in the new month for all of the work that was done in the prior month. Our direct hire hourly rate is $105 an hour. It's discounted when you have a trust open with us. So, with a trust, it's $85 an hour. There's also a fee for travel time because we can come out to see our clients in their home and community. The travel time fee is $52.50 an hour, and there's also a mileage reimbursement rate for gas mileage. We use the IRS reimbursement rate, which can change annually. We also have an annual review fee, which is a flat $200 every year. That fee is for an annual update to the goal plan. To open services with care management, you would sign the fee schedule. You're also going to select which type of contract you're hiring care management for. Your 2 options are a short-term contract or a long-term contract. The short-term contract is called the outcome intervention contract, and the long-term contract is called the continuing support contract. With either one of these, there's no minimum requirement that you have to utilize services, other than that annual update that we like to do to the goal plan. For the short-term option, usually what is intended is to solve a problem that can be resolved in 6 months to 2 years. That's what we consider short-term. It can be more than one problem. It can be several things that we're working on, but the intention is to stabilize the situation and then close out services. Some examples of a short-term contract would be if a person has newly acquired the disability through an accident and is needing to get oriented to all of the different services and benefits and get connected to those and enrolled. Or you might have a young adult who is transitioning from the school system into the adult system and navigating that transition period. Or perhaps you have someone where there is a change in housing, or the change in housing might be necessary because their health has progressed or declined and they have a different baseline for their care needs. Those are all things where there's an immediate need, and putting certain pieces into place can have the individual set up to be going forward more independently. On the other hand, we have the long-term contract. That's called the continuing support contract. It's intended for cases where you may want the care management team to be part of an individual's ongoing support system. This contract, once open, is open indefinitely, essentially until or unless you request for it to be closed. Some families use this for ongoing oversight, especially if the payment source is a family member, guardian, or trustee who is not located nearby to the beneficiary. They may hire our care managers to coordinate and monitor the person's care. Or families may want to use this type of contract for situations where they want us to be able to spring into action as needed, but we may not be needed on a regular basis. Continuing support contract can also be a great option if the trust is going to be future funded with Plan of PA. So a family might have Plan of PA listed to become trustee when a parent passes away, and they may want the client to establish a relationship with Plan of PA long before that trust is funded so that the client is comfortable with us and familiar with us. Working with a care manager on general navigation, advocacy, and goals can be a way to get that connection established. I would like to clarify a couple of points on what care management is not. We are not an emergency service. We are not open 24 hours a day, and we're not able to respond immediately at all times. We're only available during business hours, but we can help with planning ahead for emergency preparedness. We are not a hands-on direct care support, so we don't do dressing, bathing, ADLs. We're also not meant to be like a weekly support service for things that might involve routine paperwork, daily money management, an errand service, or a transportation service. There are many other options for those types of supports that are more cost-effective that the care manager can connect the client to and make sure that it's working out well and coordinate those services if there's any glitches. We can connect people with resources for a variety of needs that they may have that don't fit exactly what we do. Our care management service is tailored to the individual needs and situation. Our social service perspective is blended into the organization as a whole, and it's one of the strengths that we bring to acting as trustee.